Well, we take bleeding disorders due to abnormalities of clotting factors. The abnormalities of clotting factors can also lead to abnormal, excessive, prolonged bleeding. The deficiency of every factor is known in the literature, and the bleeding is in bleeding due to abnormalities of clotting factors not occurs in the form of petechiae or purpura. Rather, large ecchymosis or hematomas are formed after injury. The ecchymosis means large areas of radius coloration in which the blood is collected under the skin, and blood collection uh, deeper than this will lead to hematomas. In these conditions, that is in abnormalities of clotting factors leading to bleeding disorders, there is prolonged bleeding after minor trauma or surgical procedure. After minor trauma or minor surgical procedure, there is prolonged excessive bleeding. The bleeding may be into GIT or urinary tract or in weight bearing joints. And this group of abnormalities may be acquired or may be hereditary. Remembering this cascade, the clotting cascade, and remembering the intrinsic pathway and the extrinsic pathway. Intrinsic pathway evaluated by activated partial thromboplastin time APTT, and extrinsic pathway evaluated by a prothrombin time, the PT. Well, acquired clotting factor defects. Among this group, first one, the liver disease, because many of the clotting factors they are synthesized in the liver, they are made by the liver. So, in severe parenchymal diseases of liver, there is decreased synthesis of clotting factors, and when there is decreased synthesis of clotting factors, there is prolonged. It leads to prolonged prothrombin time. So that is a disease, chronic hepatitis C disease, which is unfortunately prevalent in our society nowadays. In this disease, when the disease has progressed to a level, to increased level, to a high level, there is severe parenchymal injury to the liver cells, which leads to decreased synthesis of clotting factors, and there is a tendency towards abnormal bleeding, and in these patients the prothrombin time is prolonged. The second one, vitamin K deficiency, because vitamin K is needed for production of for synthesis of factors 2, 7, 9 and 10 in the liver. The in conditions of vitamin K deficiency, there is decreased production of these factors 2, 7, 9 and 10, and there is tendency towards abnormal bleeding. A third condition is DIC, that is disseminated intravascular coagulation, in which there is tendency towards formation of small thrombi in vessels throughout the body. And in this condition, there is deficiency of multiple clotting factors, because large amount of clotting factors it is used up in the formation of thrombi throughout the body. So deficiency of multiple factors occurs with abnormal bleeding tendency. Well, we take up some of the conditions in which there is hereditary deficiency of clotting factors. In this group, the diseases uh, included in this group, they typically involve a single factor, as there is a condition called hemophilia. Hemophilia is a condition in which there is a hereditary deficiency of factor 8 It is also called hemophilia A. The factor 8, the circulating factor 8 in blood has two parts, the factor 8 procoagulant part and the von Willebrand factor, in which in combination with factor 8 procoagulant part, a complex is formed. In this complex, the von Willebrand factor, which is uh, about 99% of this complex. It binds several proteins and it stabilizes the factor 8 procoagulant part. And the most important, and this is von Willebrand factor is most important for the function of factor 8 procoagulant part because it facilitates adhesion of platelets. So in hemophilia, there is deficiency of factor 8, and in condition in which there is deficiency of factor 8 procoagulant part, it is called hemophilia A. This is most common hereditary disorder in this group. It is X-linked recessive trait. It occurs in males and carried by the females, and 30%, but 30% of the patients have no family history of abnormal bleeding, and in these conditions it is believed that new mutations have occurred in these persons. And the degree of qualitative or quantitative deficiency or defect of factor 8 varies in these patients, and by virtue of this variation, the disease varies from mild to very severe. In symptomatic patients, that is, in patients in which there is the deficiency of factor 8 level is such that symptoms are produced, there is tendency to easy bruising, and there is massive hemorrhage after trauma or surgery. As for example, after circumcision of the child, there is excessive prolonged bleeding, and it is difficult to stop bleeding from the site of surgery. In this condition, that is in hemophilia, there is spontaneous bleeding in parts subjected to trauma. As for example, when the child grows up and starts walking, it falls on the ground again and again, and he hurts his knee joints. And whenever he hurts his knee joint, there is bleeding into the joint, that is, hemarthrosis occurs. And by falling on the ground again and again, recurrent bleeding occurs into the joints, and this leads to progressive disabilities and crippling of the patient. In this condition, there are no petechiae. The petechiae are absent. The lab test will show bleeding time will be normal. Bleeding time will be normal. The platelet count will be normal. And when platelet count is normal and the bleeding time is normal, it means that the number and function of platelets is normal. The prothrombin time is normal. But the activated partial thromboplastin time is prolonged. And when we go for factor 8 assay, it is decreased, that is, the level of factor 8 is decreased in the circulation. The next condition is Christmas disease. It is also called hemophilia B. Well, the next condition is Christmas disease. This is also called hemophilia B, and this is a condition in which there is deficiency of factor 9. Well, this condition is clinically indistinguishable from hemophilia A. Similar mutations produce this disorder, it is X-linked recessive, and it may be asymptomatic, or the patient may present with hemorrhage. In some patients, there is functional defect factor 9. The lab tests in this condition, they show the platelets are normal, the bleeding time is normal, prothrombin time is normal, but the activated partial thromboplastin time will be prolonged. That is, the deficiency, the defect is in the intrinsic pathway. The diagnosis of Christmas disease is done by evaluation of the factor involved, that is the factor 9, coagulation factor 9. The next condition in this group is von Willebrand disease. Von Willebrand disease, in this condition there is deficiency of von Willebrand factor. This is common among hereditary clotting disorders. Von Willebrand factor, as it facilitates adhesion of platelets because it stabilizes the factor 8 procoagulant part, and in the complex, 99% of this complex is formed by the von Willebrand factor. By stabilizing factor 8 procoagulant part, it is important, that is von Willebrand factor is important in normal functioning of the platelets. More than 20 variants of von Willebrand disease are there. In type 1, which makes about 70% of the cases of von Willebrand disease, there is decreased quantity of von Willebrand factor. The disease is mild and it is commoner among this group. While type 3 disease, in type 3 disease, gene deletions are there, which leads to very much decreased von Willebrand factor, and it leads to severe disease. But fortunately, this is less common abnormality. While type 2 disease, which forms about 25% of the cases, there is qualitative defect of von Willebrand factor. Large and intermediate multimers of von Willebrand factor are missing, and these are the multimers which are most active parts of the von Willebrand factor. Clinically, there occur spontaneous bleeds from mucous membranes. There may be menorrhagia or other bleeding abnormalities may be there. The lab tests will show platelets normal, prothrombin time normal, APTT will be prolonged, while von Willebrand factor assay will show a lower level of von Willebrand factor. So, in von Willebrand disease, we should remember that there is platelet function defect along with the coagulation defect. And when there is platelet function defect, the bleeding time will also be prolonged in this case. In spite of the platelets being normal, the bleeding time will be prolonged in this case. We'll take up next time. Thank you.